Hello, Dr. Vergara. This is Dr. Dimere. This is Erlene.
Good
You're
morning.
good morning. You're so accomplished at a young age.
I may
Yeah.
look young po, but I'm already awesome.
Big, young ka pa rin. Yeah, and I was so impressed with your CV. Ang dami. I'll just get some points there ha to introduce you.
Apo. Please feel
Yeah, and incidentally, ang mental health kasi becomes the banner advocacy for this year for UCP. So we hope to work closely with you and Dr. Benaventura. Kasi even before the COVID, inisip na talagang there's a big need for the country. Ang daming mental health issues in all aspects, di ba po? In all aspects of society. So, yeah. And then lalo
definitely.
na ngayon, like your mic is choppy. Jasmine, let's test your mic.
How about this po?
Yeah, that's better.
I'll just go near.
Kakilala kami ni Dr. Vista. Yeah, go near. Magkakilala kami ni Dr. Vista. I asked him about you.
He knows
Boy,
me po.
Benjamin Vista. Yeah, kasi you work for his place, right?
Indeed.
Before, the Algon Foundation, something.
Doctora, I think we can start now. We're live on Facebook.
Okay, we're live. Okay. Good morning, everyone. We'd like to give a webinar on helping medical frontliners cope with the psychosocial impact of COVID-19. And to officially start this webinar, I would want to welcome Dr. Mario Panaligan, the current PCP president, to formally open our session.
Hi, good morning. Thank you, Dr. Demere, for accepting this task to moderate this particular webinar conference on helping medical frontliners cope with the psychosocial impact of COVID-19. Indeed, this is quite important, especially now with the COVID pandemic. And all of us know that the medical frontliners are always the ones tasked on handling COVID-19. But certainly there are lots of issues related to the management of COVID-19, particularly on the primary handling when they encounter patients suspected to have COVID-19, and thereafter, of course, when they manage these patients. And of course, these people are always thinking of the possible risk of getting the disease. And therefore, this would affect the way they handle these patients and somehow would cause or would result to some anxiety issues as well as the worries related to getting the disease. At syempre, ang pinakamahirap dyan, pagka nagkaroon na ng problema sa isang tao doon sa ospital, marami na rin nagiging natatakot, no? Kasi posible nga naman mahawa yung iba. At ang pinakamahirap yung pag nawala na ng tao, no? Kasi syempre dahil nandun yung fear, nandun yung anxiety, um, natatakot na sila na mag-report, no? And that could, of course, affect the way we handle our patients who are in need, of course, of getting treated and getting handled properly. And therefore, we are fortunate to have two good speakers. I know, of course, one who is my co-faculty in URN, and that's Dr. Benaventura. And of course, from the WHO, Dr. Vergara. And definitely we will learn how to understand, or we will learn to understand um, the concepts of on the mental health of our colleagues, particularly the frontliners, and how we can address such problems. Now I welcome everybody, particularly those who are listening to us and hearing us in Facebook, and certainly we will be uploading this in our YouTube page. And of course, for all the registrants to this webcast conference, I welcome you all. Thank you. Arlene? Dr. Demere?
Thank you. I think our Yeah, good morning again. And as Dr. Paniligan said, this is a relevant topic. And I thank the Committee on Continuing Medical Education of the PCP, headed by Dr. Aldrin Loyola, and Dr. Agnes Cruz for coming up with this topic. And we thank PCP to have connected with the Department of Health and bringing us very good speakers. And our hope through this webinar is not only to educate the listeners, but to help our COVID-19 liners. They go through all these added physical, mental, and emotional stresses, all psychological toil on our frontliners. So knowing that before the pandemic, as a frontliner, we already had stressful situations. And because frontliners or healthcare workers face all these unexpected stressors, infection, moral injury, and sometimes lack of social support. So we hope that this webinar will be relevant and will be useful to all those listening, not just for ourselves. As we learn, we can also I think I got cut off. Anyway, we should start. We have few speakers. Uh, say educator has about his field, and he earned his Bachelor of Science major in clinical psychology and graduated from Western University. Then on morning. Do you hear me? Hi, good morning. I think I lost myself.
Yeah, can you
Good
can go
morning
on,
again.
Erlene? Yeah.
Sorry. Yeah. So I'm sorry my internet just went off, but as I was saying, I would like to thank Dr. Aldrin Loyo, Chair of the Committee on CME, and Dr. Agnes Cruz, and of course with the blessing of Dr. Mario Panaligan to hold this webinar for all of us to learn. We have two very good speakers, very experienced and knowledgeable, and we start with Dr. Robert or Bong Benaventura, who has very much to share. He finished his Bachelor of Science in major in clinical psychology, graduated magna cum laude from the Far Eastern University and finished had his residency training. Then he proceeded with his postgraduate training in psychiatry, the Psychiatry of Old Age in New South Wales Institute of Psychiatry, Sydney, Australia. He is a diplomate and a life fellow of the Philippine Psychiatric Association, and he loves to write. He wants to share his passion. So he's a former editor-in-chief of the Philippine Journal of Psychiatry. And currently, he is the secretary of the Certification Committee, Specialty Board of the Philippine Psychiatric Association, and the treasurer or the board of directors of the Philippine Psychiatric Association. He currently is a consultant in psychiatry at the UERM, as well as the head Department of Psychiatry in the Manila Theological College, College of Medicine, Santa Mesa, Manila. So indeed, we have a very good speaker in front of us who will now share his knowledge. Welcome, Dr. Bong Benaventura. Dr. Bong, I give you the floor, Dr. Bong.
Doctora, if he's not available at this time, maybe we can start with Dr. Vergara because she can provide us with a global perspective. And then we can proceed with the local one with Dr. Bong as the second speaker.
Okay, that's good. Yeah, because I thought Dr. Benaventura is ready and is just getting his slides set. Of course, let's go global first. We have a very beautiful and talented and knowledgeable speaker in our midst. She's a technical officer, the National Professional Officer in Mental Health and Substance Abuse of the World Health Organization, country office here in Manila. They actually provide technical assistance to the Department of Health, National Mental Health and Dangerous Drug Abuse Prevention and Treatment Program in partnership with other organizations to support key priorities. And among those priorities is mental health literacy and priorities. They have six. I would highlight three, which is the World Health Organization's mental health, with the Philippines as one of the facing, right? And another priority in the COVID-19 response and the development of the implementing rules and regulations of the Philippine Mental Health Act for the formulation of a strategic plan and policy development and reviews in line with the World Health Organization Global and Regional Plan of Action for Mental Health. She is currently enrolled in the Nova Medical School and Lisbon Institute of Global Mental Health for the diploma course in Lisbon International Learning Program on Mental Health Policy. Okay, and she Mental Health Policy and Services Organization. This is for 2019 to 2020. She finished her degree of Doctor of Medicine degree from the Far Eastern University and had her residency training at the Makati Medical Center, where she achieved a 4-year residency training in psychiatry, serving as chief resident in her senior year. She was also a resident in neurology at the Makati Medical Center in 2003. So what followed all this basic education for Dr. Vergara is phenomenal. She developed experience in her field beginning early in her career as the part of the Behavioral Health Division, Bureau of Public Health, Ministry of Health, Republic of Palau, where she served for many years. She served in various capacities, including being the psychiatrist ER physician from November 2011 to 2014 in clinical psychiatric services, mental health and substance abuse for adult, child, elderly, and forensic evaluations. And mind you, she was the sole psychiatrist of the entire hospital at the time. She was a consultant psychiatrist overseeing the development of the System of Care project of the Substance Abuse Mental Health Services Administration of the United States and administrative tasks and workforce development of the division. She served as consultant of the National Community on UNCRPD in Palau, with especially for the health and rehab services. You can see she has really served Palau for many years, that she continued to show her skill in being a good facilitator and organizer for the World Health Organization Psychological First Aid, doing workshops for emergency health partners in Palau. And then she continued to shine as she led the World Mental Health Day in 2013. This was a seminar for the beautiful mind, managing stress for psychological wellness in Palau by the Behavioral Health Division, Ministry of Health. She has a very long CV, but I see that her passion for mental and behavioral health has made her a much sought speaker locally and internationally. She has gained experience and knowledge to the various commitments she made, and to mention a few, she served the One Algon Place or Academy of Hope in Laguna, Robert Powell, and she became a resource person and lecturer in various work groups. And because of that, awards come easy for her, and she was cited in the foreword for her participation for psychosocial response as a young psychiatrist volunteer in the resource book of the WAPR Philippines and the PPA for Psychosocial Intervention Training Program. Indeed, we have a gem in our midst, accomplishing so much in her young age with a wealth of knowledge and experience, which of course we know it equals wisdom in mental and behavioral health, especially in crisis situations with emphasis on healthcare workers. So may we learn much from this brilliant and beautiful lady who has gained for herself a wider view of things from the World Health Organization. Make sure your internet connections are good as we join in welcoming our speaker, Dr. Jasmine G. Vergara. Take it away, Dr. Vergara.
So thank you. Thank you for that comprehensive introduction. And we thank you for the PCP, Philippine College of Physicians, through the Department of Health for inviting the WHO in this webinar. So to continue, I'll just provide our brief agenda or discussion for my presentation. I'd like to present first WHO and the works that we are doing. What is mental health and why it's important? The impact of COVID-19 on mental health, the MHPSS consideration during the COVID-19, the mental health and psychosocial response, the intervention pyramid by the Interagency Standing Committee, and of course, to end up is the building back better. So to start off, here is WHO. We are the specialized global health agency for United Nations. And since 1948, and we have been working worldwide to promote the highest standard of health for all. Our mission is to promote health, keep the world safe, and serve the vulnerable. Access to affordable and adequate health care is a human right, and universal care. Healthcare is a key principle of the guiding WHO's work. By 2023, under the global general program work of the WHO Secretariat, WHO aims to ensure that 1 billion more people are benefiting from the universal health. 1 billion more people are better protected from health emergencies, and 1 billion more people enjoying better health and well-being. On the front of mental health, WHO works with the Department of Health closely here at the country office and key partners, the Philippine Council for Mental Health and key partner agencies to improve the mental health of individuals and society at large. This is encompassing the promotion of mental well-being, the prevention of mental disorders, and efforts to increase access to quality mental health care that respects human rights. And I'm happy to share that last year in 2019, WHO launched this WHO Special Initiative for Mental Health for the next 5 years, 2019 to 2023. That's universal health care coverage for mental health to ensure access to quality and affordable care for mental health conditions that would be covered in 12 priority countries to cover 100 million more people in that scope. And Philippines is one of the first 6 countries that have initiated or have started work in this. So we are committed, and the Department of Health and its partners are committed to this special initiative. As in the definition of WHO's Constitution of Health, mental health, as you know, is an integral and essential component of health. It is, when you define health, it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And this is an important implication of the definition of mental health, because it is more than just the absence of mental disorders or disabilities. And when you define mental health, this is the WHO definition of mental health. It is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to contribute to her or his community. This is mental health is has a large intrinsic value as it relates to the core of what makes us human, the way we connect, the way we interact, the way we learn or work or experience suffering or happiness or enjoy life. So I'd like to highlight this, that good mental health supports the capability of individuals to display, healthy behavior that keeps themselves and others safe and healthy during, especially in this pandemic. When we talk about good mental health, it also facilitates that people perform in key roles. If you are taking care of our children at home, or you're working at the front lines, or you're working in the community and supports, or protecting and supporting the older adults, or contributing to the community's economic recovery, your mental health is very, very important. So good mental health is critical to each country's response. And I'd like to highlight this. At the highest level of the United Nations, our Secretary General released a policy brief last May. And during the crisis, during the COVID-19 crisis, although the COVID-19 crisis can be, in the first instance, a physical health crisis, it has the seeds of a major health crisis as well, if critical to the functioning of society at best of times. And it should be, and it must be at the front and center of every country's response to and recovery from the COVID-19. So I'd like to highlight and congratulate PCP for making this time to focus on mental health, especially for the frontline workers. So before the COVID-19 emerged, I'd like to situate everyone that statistics on mental health conditions were already stark. Even in the Philippines, we don't have complete data, but later in the global level, the economic losses is more than $1 trillion per year due to depression and anxiety. This is brought about by absenteeism or presenteeism at the workplace. Depression affects about 264 million of people in the world. Around half of all mental health conditions start by age 14, and this has been supported by evidence and science. And suicide is the second leading cause of death in young people aged 15 to 29 globally. More than 1 in 5 people living in settings affected by conflict have a mental health condition, and globally there's less than 1 mental health professional for every 10,000 population. As well as human rights violations are evident worldwide. In the Philippines, before the COVID-19, this is the statistics, and we have in 2015 from the global health estimates, there is about 3.3 million of cases, people with depressive disorders, and about 3 million of cases people have anxiety disorders. In any epidemic, as we go to any disaster situation, emergency situation, epidemic, and now it's a pandemic, it is common for individuals to feel stressed and worried. Either you'd be affected directly or indirectly. These are the common responses. People have fear of falling ill or dying. There's an avoidance of approaching health facilities of the fear of getting infected, fear of losing livelihoods because of disruption of work settings or work opportunities, fear of being socially excluded or placed in quarantine because of being associated with the disease. And that's where the stigma comes in. Feeling of powerless in protecting loved ones, fear of losing loved ones because of virus or any infectious disease or emerging emergencies. Feeling of helplessness, boredom, or loneliness, and depression due to the being isolated, and fear of reliving a previous epidemic. And in any mental health emergency, we'd like to also highlight the before situation, before any emergency situation takes place. There are already some types of problems that are pre-existing. It can be some social problems. It can have some mental health problems. So some social problems can have poverty or discrimination. People already are are marginalized or people who already have a pre-existing mental disorder, may it be a substance abuse disorder or schizophrenia or even some form of depression prior to the emergencies. And now coming to have to face the situation, they will be at risk of developing mental health conditions as the mental health of the population declines. So the impact of COVID-19 on mental health, this is according to our Director General, Dr. Tedros, has actually on people's pandemic is already extremely concerning. The social isolation, fear of contagion, the loss of family members is compounded by distress caused by loss of income and often employment. You know, there are a lot of stresses coming in, as also highlighted by Dr. Demary earlier. Frontliners already have a previous stresses prior to the COVID-19, and coming to facing this crisis may brought additional stresses, and we will highlight that later. Just like to share this. This is the Lancet Commission on Global Mental Health and Sustainable Development. This was officially released last in World Mental Health Day in 2018, but they already have previous series of Lancet series in the past. One of the key messages from the Lancet Commission on Global Mental Health is that mental health problems exist along a continuum of, from mild, moderate, time-limited distress to severe mental health conditions. In any approach, we need to approach mental health in this full spectrum, from well-being to some mild, moderate, severe, conditions or symptoms. The COVID-19 pandemic influences where people are situated in this continuum. People before who doesn't have, symptoms of anxiety and distress, or are experiencing some level of distress because of the multiple stresses generated by the pandemic, as I highlighted. People before that have some mild conditions or mild symptoms are also facing additional stresses that can put them in increased number of anxiety or depression, as well as people who have previous conditions, mental health conditions, have or may experience worsening or exacerbating of their condition. So this is how we would like to look at it. So mental health and COVID-19. So as we focus more on the impact of COVID-19 to our mental health, the population or individuals, the fear, worry, anxieties are normal responses to perceived real threats. And at times we are faced with uncertainty or the unknown. We always get to hear some people, fearing of what will happen, what would be the consequences this, and it's normal. So it is normal and then understandable that people are experiencing fear in the context of the COVID-19 pandemic. Added to this fear, the significant changes in our daily lives, because we have to consider the long, chronic state of it, or the restriction of the movements in efforts to support efforts to contain and slow down the virus and the spread of the virus through the quarantine or the different travel restrictions, and that we need to follow those physical distancing, those non-pharmaceutical intervention that we need to practice are going to be part of our routines. Faced with new realities of working from home, like what we are doing now for working and communicating online, temporary unemployment, homeschooling for children, and lack of physical contact with other family members, friends, and colleagues. It is important that we look after our mental health the same way that we look and take care of our physical health. Now, to focus on the frontline workers, which is the main theme of this, and I believe most of our listeners are in the front lines, the medical frontline workers, may experience additional stressors during the COVID-19 outbreak. This can be, our frontline workers can be like the doctors, nurses, ambulance drivers, case identifiers, everyone that are working at the front lines. The stigmatization they have experienced towards the working with COVID-19 patients and their remains, they are experiencing additional stresses in this. The strict biosecurity measures, having to put on the physical protective equipments and having that physical strain of the PPEs. Physical isolation, making it difficult to provide comfort to someone who is sick or distressed. As much as they want to get and be there for their people, for the other people, that isolation is limiting them. That constant awareness or being vigilant at all times, or having to follow strict procedures to follow preventing spontaneity and autonomy. These are the other stresses, the stresses that the frontline workers are experiencing. Those higher demands in the work setting, including long hours of shift than, if you were experiencing 8 hours of shift before, having to experience 12 hours or even some extended, increased number of patients, and keeping up to date with the best practices as information about COVID-19 develops. There's a reduced capacity to use social support due to the intense work schedule, and we've been hearing that people or the people at the front lines doesn't have much time. But in this webinar, we hope that you will find time to take care of your mental health. Globally, depression and anxiety are increasing. A study in Ethiopia in April 2020 reported there's a 3-fold increase in prevalence of symptoms of depression compared to the estimates before the epidemic. For the frontline workers, some studies show that during the pandemic in China, healthcare workers have reported high rates of depression, about 50%, anxiety of about 45%, and insomnia of 34%. In Canada, 47% of healthcare workers reported a need for psychological support. In the Philippines, the Department of Health is leading this different surveys and identifying the needs of the frontline workers, and we hope to await further results and succeeding interventions. So as we go and see the impact of mental health in society or in the population, I'd like to present this intervention pyramid for mental health and psychosocial support. And coming from that continuum spectrum of mental health and psychosocial needs, this is the mental health and psychosocial support intervention pyramid coming from, as we recommended within the outbreak or emergency response activities. As mentioned, this is aligned with the spectrum of mental health and psychosocial needs are represented from the base of the pyramid. You'll see there that a lot of people would need some social, some intervention for social consideration in the basic services and security, and different actors or different sectors other beyond the health sector are providing support in this category. Strength at the next level, strengthening community supports and family. This is where also roles of the Department of Health, Department of Education, Department of Social Welfare and Development, the LGUs are focusing on communal traditional supports, the community engagement. As you go up to the next level, a focused person-to-person intervention by non-specialized individuals or physicians. Having to provide basic mental health care by primary health care doctors. A lot of our physicians or at the RHUs are trained on MHCAP, but I'll share that later as well. And as you go up to the level of people who would be needing specialized services to be provided by our specialists, the psychiatrists, the psychologists, the neurologists. Those are the ones that would actually be provided and are for facility-based as well. So encompassing the mental health and psychosocial support, this is the overall overarching principles, and there should be clear coordination mechanism and integration of MHPSS technical expertise that are critical. The Philippines has its own department memorandum on this and how the different actors play their specific roles at the different levels of the intervention pyramid. May it be a local, NGO or international NGO, the same way with the different sectors of the government. We'd like to highlight in here the principles of, hope, safety, empathy, and social connectedness for self and community efficacy should be embedded across every intervention. It's not just we're moving away from the word social distancing, but we use physical distancing as a mean to delay or stop the spread of the virus, but it should not stop us from socially connecting to our friends, our family, our loved ones, and our colleagues. Local actors need to be supported as mentioned, and I'd like to highlight that people with mental health and substance use disorders with psychosocial disabilities who have experienced the interrupted services should have to continue their support or treatment. In this slide, we'd like to highlight that the value of being kind to all affected people. May it be people who have the COVID-19, people who are recovering from COVID-19, people who are taking care of people with COVID-19, because there are evident discrimination or social stigma happening who have been infected, and proper information and communication to the individuals and community can help address the social stigma. The essence in this is we have to be kind to everyone. People who have recovered from COVID-19 will go on with their usual lives, will go on to meet their purpose in life, and the disease should not define their overall personality. So our message to healthcare workers, right? So as highlighted earlier in the introduction, many health workers feel under pressure, and it's normal to feel that way. And it is also shared and experienced by many of your colleagues or coworkers. And stress and feelings associated with this, COVID-19 in this current situation are by no means a reflection that you cannot do your job or you are weak. In fact, the stresses that you may be feeling can be a source of motivation to let you go and let you move along and serve your purpose. This is a unique and unprecedented scenario for all workers, especially at the front lines and the medical frontliners. Even so, we'll try to remember the strategies that have worked for you in the past, and it can be, can be helpful to help you address the stresses that you are experiencing now. So our message is you have to manage your mental health and psychosocial well-being during this time, as well as much as you manage your physical health. Try and use helpful coping strategies, such as ensuring that you have sufficient rest and recuperation during or between work shifts, eat sufficient and healthy food, engage in physical activities, and stay in contact with family and friends. And I would like to highlight avoid using unhelpful coping strategies such as tobacco, alcohol, or other drugs. Some people may think, or some individuals may think that, okay, one drink can be soothing for them to address their stress at the moment, they may feel relieved, but the long-term consequences of that drinking or smoking or using others' drugs can worsen your mental health and physical well-being. So turn to your colleagues and trusted person, your supervisors. And as we send our message to the team leaders and managers, we have to have and keep all staff protected from chronic stress and poor mental health during this response, and means that they will have a better capacity to fulfill their goals. When you plan and support your staff in the response, you have to look at it at a long-term perspective, having to have strategies that may have some short-term goals, but in a long run, having to fulfill that, occupational capacity is there, kind of like a foresight, foreseeing. Ensuring that good quality communication and accurate information updates are provided to all staff. This is where we minimize the rumors or the misinformation, having to get reliable information from the Department of Health, from us at the WHO. We will be sharing later some applications and information, where to access them, so you'd be equipped with the information that you need to know. In the COVID-19 pandemic, or even in any pandemic, there's also a positive light or a positive experience that people are seeing. Faced with this disaster, community members often show great altruism and cooperation, and people may experience great satisfaction from helping others. This is where we exemplify our values of being kind to ourselves and to others, and having to have that feeling that you're able to help others means you're able to help yourself as well. So these are some of the examples that are exemplified in the community. Maintaining social contact with people who might be isolated using phone calls or text messaging or radio. Sharing factual messages, key factual messages with the community, especially with individuals who doesn't have social media, especially for the GIDA areas or other areas that are not reached by internet and Wi-Fi or electronic means, and providing care and support to people who have been separated from the COVID-19, the isolation. So in here, just to bring back the intervention pyramid of the mental health and psychosocial support from the interagency standing committee at the response level, these are the key information or activities that can help to have an effective emergency response. There is some community self-help and support, social support should be strengthened, psychological first aid at the level that there are trained individuals that are even non-health providers that are providing psychological first aid, basic clinical mental health care covering priority conditions by non-specialists or by non-psychiatrists or neurologists, providing psychological intervention. This is where the task sharing between the specialists and the non-specialists to provide that psychological intervention for low-risk individuals, protecting and promoting the rights of people with mental and psychosocial social concerns and needs. To provide a different lens of that continuum of care or that spectrum. I know this is a busy slide, but let me ask you to focus on this element of the arrow, from mental well-being to more specific syndrome or conditions. As you move to the different intervention when you don't have much symptoms, or you are having no distress, there are some public health, mental health promotion and illness prevention that we are providing at the government or providing. So these are having to keep in mind to address that and get access when you need help. At the level of where you have some stage of non-specific mental distress, there could be some form of self-help and support from networks in the community. Some informal supports can be provided here. at the level of the early treatment, where symptoms can have, you can have some subsyndromal or subthreshold symptoms. This is where we provide some psychological intervention that are transdiagnostic, where you can have, let's say, there's a problem management plus that we have published that they can be provided to address people with anxiety and depression, but at a sub-syndrome or sub-threshold symptoms. And when the symptoms have been fully defined or under a syndrome, a first episode of treatment of care can be provided at the primary care. Specialist care may be available to have that supervision or collaborative work with the primary care. And as you go up to the stages of the different symptoms, and the recurrence, you can have a referral to the psychiatrist, to the neurologist, to the psychologist, to the experts or the specialists, or a higher level of care, the tertiary level of care. And having to have that collaboration also with the primary care physicians. So this is the Lancet Commission on Global Mental Health. This is what you call the staging approach to mental health intervention and treatment and care. So with that, like also to present the different tools and publications that WHO has produced. WHO, as mentioned, works together with partners, with supporting the Department of Health and key partners on the ground in providing guidance and advice during the COVID-19 pandemic. We have released some different publications to support, or people supporting children, older adults, people in isolation, and members of the public in general, to help us look after our mental health. So you can see here, there are different interim guidelines that we have released. WHO also sits as a co-chair of the Interagency Standing Committee Reference Group on Mental Health, and has this basic psychosocial skills, a guide for COVID-19 responders. My Hero Is You is a book. It's a children's story book that is already has been translated to Filipino and Hiligaynon. We are in the process of producing an audio file for this, so we can actually support children that are, have to cope in the COVID-19 situation. And WHO recently released also Doing What Matters in Times of Stress. So it is something that can be helpful to everyone. Just to highlight, this is the basic psychosocial skills, a guide for the COVID-19 responders. So it's an illustrated skill, and you can find some practical advice for taking care of one's mental health and well-being, how to communicate with empathy, and how to help people suffering from stress or severe distress. A guide also that we, as mentioned, this is a stress management guide for coping with adversity. So in any form of adversity, you can have and use the practical skills that you can learn from this guide. It aims to equip people with practical skills to help them cope with stress. It also has audio files. You can find this in our website at who.int, and you can find that it comes with audio files, and it has a different, you can go through like 7 to 10 minute audio guide, how to practice those practical skills to address stress. WHO also recently released and launched the WHO Academy COVID-19 Learning App. It's an app where, in the future we'll have more different topics for capacity building, knowledge sharing, and research and development as well. This is available via the App Store, Apple iOS Store, and Google Play. You can download this. This is for free. So for the frontline workers, you can find key features, including guidance and learning materials in the COVID-19 situation, or topics on case management, IPC, epidemiology and everything. Section on coping with stress is highlighted there as well. So at the primary level, there's are the different interventions or tools that we have launched or released. This is what you call the Mental Health Gap Action Program. When we say Mental Health Gap Action Program, it's composed of different tools and modalities and interventions. So there are clinical tools for non-specialists. What we have now is the Mental Health Gap Intervention Guide version 2.0. I believe our physicians at the RHUs and the non-specialists most of them have been trained. If you're not trained, you may find it useful to get yourself in addressing the priority conditions of mental health. It also comes in an application format, and you can download the e-ImageGap also on your iPhones or your Android phones. There are also tools for capacity building. So we have the intervention guide, the humanitarian intervention guide training materials, the community toolkit. So the different levels of intervention that I've showed earlier, there are different levels of tools also that can be aligned in that. For the district managers or the leaders, we have the ImageGap Operations Manual, which we are designing and working with the Department of Health of implementing it, of how the regional CHDs and the LGUs can better shape the mental health programs in the community, and some psychological interventions also, the Problem Management Plus, Thinking Healthy, Group IPT, psychological stress techniques. So for mental health emergency, this is also available in our website. So this is an adaptation of the intervention guide, but it focuses on the humanitarian setting. So you can find modules on stress, grief, PTSD aspect. It doesn't have to have that high level of other mental health conditions. Other general principles of care can be addressed here: how to communicate properly with your patients, how to address or assess individuals who may need address help in the humanitarian setting, reducing stress and strengthening social support, the protection of human rights, and attention to overall well-being. So to, as I go and almost end my presentation, with all of this happening and how we look at the future and having to see all the resources, all the capacities that have been initiated in the COVID-19, how we build back better, sustainable mental health services or systems beyond the emergency response is we need to strengthen and apply a whole of society approach to promote, to protect, and care for mental health. This is where an important role of, a saying that when it comes to mental health, it's everyone's business. It's not just the health sector, it's the business also of the educational, the workplace, the safety officers. Everyone has a role to protect and promote mental health. There should be, we have to ensure widespread availability of emergency mental health and psychosocial support at the different levels of care or intervention, and support recovery from COVID-19 by building mental health that is fit for the future. WHO actually has released back in 2013, this is Building Back Better, where WHO demonstrated in different countries the key elements of how to build a better, building back better. This is in the form of, just like to highlight some elements of this or some strategies to promote sustainable change within the public mental health system after the crisis, planning for the long term, as mentioned, addressing the population's broad mental health needs. Every single individual should be taken into consideration respecting the role of the government in this response and beyond, engaging the different societies, different national professional organizations, NGOs, service users organizations as part of this, ensuring effective coordination, reviewing the mental health plans and policies, and as the Philippines has its Mental Health Act, how it can be reshaped further to adopt the current, incorporate the current capacities on the COVID-19 response and beyond, investing in healthcare workers and using pilot projects and demonstrating projects and increasing, using this as an advocacy to maintain the momentum for change. With that, I'd like to share that we have in our WHO Philippines Facebook page, we have released some communication materials even on our website. And to end my presentation, as frontline medical workers in this field, your well-being is very important. Before you can help others, you need to look after yourself. When we talk about maintaining the same way as you want, that car needs to fuel and drive, you need to have yourself, full, having to have a full tank to keep you going. The helping in the COVID-19 response is a long distance race, and it's not a sprint. So build on that daily mental health and well-being in your daily routines. Thank you to our COVID heroes. This has been featured in our Facebook page, and we'll be featuring more as months to come. That's all. Thank you.
Thank you very much, Dr. Vergara, for on mental health for healthcare workers. Indeed, a lot of us have learned and gleaned into the importance of taking care of our mental health individually as well as those around us. So our next speaker is, as I've introduced earlier, is Dr. Robert Bong Benaventura. He is currently a consultant psychiatrist at UERN and the head of the Department of Psychiatry of the Manila Theological College. His experience and vast knowledge will be shared today, and we hope that we will be able to focus on his discussion. Thank you, and take it away, Dr. Bong.
Thank you, Dr. De Mere. I hope you can hear me.
Yes, we can hear you.
Oh, great, thank you. I'm just trying to share my screen. Can you see my screen now? I hope you can.
Yes.
Okay, great. Thank you.
Yes, we can see your screen and we can hear you well. Thank you.
Thank you very much because I can't seem to see myself. Okay, so mabuhay at magandang umaga po sa inyong lahat. So thanks to PCTN, PISMID for the invitation to be one of your speakers this morning. And I'm also very pleased to be sharing the panel with Dr. Vergara. A special shout out to Dr. Panaligan and of course to Dr. Dingdong Birwar as well for facilitating this lecture. So for my segment of the talk this morning, I'm going to focus on helping medical frontliners cope with the psychosocial impact of COVID-19. And Dr. Vergara has already given us the top level view. Okay, and these are my objectives. As I was mentioning, Dr. Vergara has provided a very comprehensive and detailed landscape, excellent situation about where we are right now. So for my purposes, I will focus more on the pragmatic considerations of this situation. For this section, our objective is to identify online resources, organizations, and helplines that physicians can refer to if they come across patients and or professionals with adjustment difficulties. We are very fortunate that the number of online resources have increased in the last 3 months, not just in Metro Manila, but in other parts of the country as well. And these resources have become more accessible. So what do they include? Well, in particular for direct one-on-one patient psychotherapy or counseling, there are various telemedicine platforms that can be used. I personally use these two. We are all very familiar with CUSMD because it's open to all types of specialists, but Recovery Hub is a platform designed primarily for psychiatrists. Okay. As psychiatrists, we feel fortunate that these platforms are available because they have been a very good fit for our practice, and a lot of our patients have adapted to it quite well. The main challenges that I've experienced have been primarily been technical in nature. Okay, even our patients have had some difficulties as well connecting to the platforms, and the reason for that primarily is our digital infrastructure is not yet optimum. Thus, there are patients who would rather have face-to-face consultations. So it's also great that outpatient clinics are now starting to open with the necessary precautions and guidelines in place. Now, as far as crisis hotlines are concerned, we have 3 to 4 major crisis hotlines in the country right now. I mean, serving nationwide. I'm going to mention primarily the crisis hotline of the National Center for Mental Health in Mandaluyong. The advantages to these hotlines are the following. First, they are free, they are confidential, they are available 24/7, and they are staffed with fully trained counselors. The main drawback is that there could be a waiting period before the call can be answered due to the high volume of calls. Okay. Prior to the ECQ, the NCMH crisis hotline was averaging 200 unique calls a month. Early this month, they said that it has doubled to 400 calls a month, and estimates are that 60% of the calls are directly COVID-19 related, according to some of their top officials. They have also upgraded the system since a week ago. They are now able to accept landline to landline toll-free calls from anywhere in the country, thus making the service more accessible now to those in need. So for those of you who are not familiar with the NCMH crisis hotline, initially they only had the Globe line, okay, Globe mobile number, and then a landline that was accessible primarily in Metro Manila. But since last week, they have had this toll-free number, yung 1553, which interestingly is also the zip code of the National Center for Mental Health. So now it's more accessible. Okay. They also have actually a telemental health service for frontliners and for OFWs, but it is undergoing an upgrade at the moment, so it's not accessible. So they still use the crisis hotline that they already have. Okay. Now, what are the other resources that are available? The UP Diliman Psychological Service and the Philippine Psychiatric Association have both started free direct phone consultations to medical frontliners almost as soon as the lockdown started. So within days of the lockdown, both these organizations started this free consultation service. Initially, of course, these were primarily dedicated to frontliners. But because of the demand over the ensuing weeks, they opened their services to other affected individuals, including family members of the frontliners. However, unlike crisis hotlines, the services were not available 24/7. So an appointment would have to be made. The advantage was that the client would be able to speak to a trained psychologist, and in the case of Mind Matters, they would be talking to a board-certified psychiatrist who could also provide a digital prescription if necessary. This is from the Facebook page of the Psychological Association of the Philippines, and they have provided an excellent list of other centers nationwide offering free counseling. This list includes centers from different parts of the country, which is great. And from the original list of 22 centers in April, it has now gone up to 37 centers nationwide. Okay, I'm sorry, it's difficult to read, but I just wanted to highlight the fact that there are a number of institutions or centers nationwide that are offering free counseling, not just to frontliners, but to other affected individuals as well. You can access this at the, as I mentioned earlier, the Facebook page of the Psychological Association of the Philippines. And I've also provided a copy of my presentation to the PCP so they can share this as well. Okay, so for the next section, my task is to describe how health workers can personally take care of their mental health. And again, I will discuss this primarily from a practical perspective because Dr. Vergara has already provided us salient processes in terms of how a frontliner who's in distress can help himself or herself. And that's the reason why I'm calling these practical tips, because a lot of this are stuff that we already know or have heard of, or something that will make us say, why didn't I think of that? Okay, so let's start primarily with the very basic one about self-care. So we need to practice self-care, eat well, sleep well, hydrate, exercise, maintain proper hygiene. And if the frontliner has chronic medical conditions, let's say such as hypertension or diabetes, then they have to be able to, they have to ensure that they take their medications. Okay. They need to focus on timely and accurate information from reliable and credible sources. So one credible resource, of course, would be the WHO, and in our local setting would be the DOH as well. So we need to be able to filter that. And as members of the PCP, you may also get your information direct from the officers of the organization. So the information would already be filtered and be more accessible to the individual member. And one important task that we need to do as well is to limit our exposure to mass media and social media. Unfortunately, particularly during the early parts of the pandemic, there was so much information, okay, that was available, both factual information, but unfortunately, this was mixed with fake news, misinformation, and even sensationalism from the mainstream press. So it could be very overwhelming, not just for the frontliner, but for any individual who had to sift through all those information just to be able to find something that would be helpful to them. And so one way to deal with that is to limit the exposure. I personally recommend only about 3 to 4 times a day, 30 minutes to 1 hour each time. But there are those who really, particularly for individuals who are adversely affected by the amount of information that they are encountering, sometimes it could be limited to just once or twice a day. So what are the other tips that the individual can follow? Okay. It is important to educate oneself, okay, and follow recommendations. We as physicians know about this. No? So by this time, everyone knows already about proper hand washing techniques, about how to put on face masks, donning and doffing PPEs, okay. And then following recommendations in terms of example, like staying home, and then what are the guidelines that need to be followed. It is also important to reach out and connect with family and friends. It's been very well established. This was something that Dr. Vergara mentioned as well, that emotional support, not just from our loved ones, but from our colleagues as well, would be very critical. In fact, some studies have already shown that emotional support from other individuals would be one important factor to be able to shore up or build up an individual's resiliency and to allow the individual to be able to adapt to this situation. However, if you know someone who's isolated, and a lot of people are, for example, I know of a young UERM graduate who's a volunteer to the Doctors of the Barrio program who was caught by the lockdown up north, and therefore he had been physically isolated from his family. Although there was some digital connection, but still, it's different actually being with your loved ones. So if you know someone who's isolated, then let's reach out to them. Just send out a text or call them up and just ask, hey, how are you doing? Is there anything that I can do for you? Okay. Because that can be very helpful, especially for someone who feels that they're trying to go through this all by themselves. And they need to be able to engage in enjoyable activities, hobbies, and crafts. We're very fortunate that, for example, a lot of online courses have become available, musical plays, or other forms of entertainment. But this would also include, having a great time with our family and friends. A lot of people have been working from home, so therefore it has given them the opportunity to be able to, let's say, for example, have lunch or have dinner with their family members, be able to share a moment in which they could actually talk. Unlike before, when they have been, so focused on other things. But with frontliners, particularly our young frontliners, I'm specifically referring to residents who need to be staying at the hospital for long periods of time, then therefore this could be an important opportunity for them to be able to, feel better if they're allowed to be able to go home and interact with their family members or loved ones. What else? I've often said to including my patients and other colleagues, to be able to think positive, be positive, act on things what one can control. But I'd like to add also that we need to keep things in perspective, because we need to still be realistic. So this is something that's called optimistic realism. Okay? I mean, it's good to be hopeful always, but pure unreserved optimism may actually be counterproductive in terms of meeting our expectations and goals. And that's the reason why we need to partner that with some degree of realism. Okay. People tend to feel loss of control, hopeless and helpless in this situation, okay, because they feel that they're often been boxed in. So therefore, it's important for them to be able to have some degree of control in some aspects of their lives. Okay, so like what they can do on a day-to-day basis, that's something that they can control, and that can help minimize yung feelings nila of being helpless. Allow the opportunity to make decisions, to make plans, draw up a schedule. Developing a routine can be very helpful because oftentimes, because our schedules have become disrupted, our body rhythm have become disrupted as well. So therefore, following a routine can be very helpful. And to be productive, of course, they're very busy, but at the same time, there are other things that they can do, help, volunteer, donate, share the resources as well, because this can improve our feelings of self-worth and improve our feelings of self-esteem. Because oftentimes what they may be doing can be very frustrating, especially at the outset when things look so bleak. Okay, but now that things are improving, but there are other things that they can do to help themselves. Increase self-awareness. This actually is very critical as far as I'm concerned. So this reflects on what we refer to as mindfulness behavior, to be in touch with oneself, to be able to monitor our thoughts, feelings, and actions. And this can be done, at a quiet time. And a good time for that would be at the end of the day, just before you go to sleep. So we need to look back at what happened during the day. How did we react? How did we feel? How did we respond? Because the first step to developing full resiliency is to develop that degree of self-awareness, to be able to acknowledge that a problem exists and that a challenge is confronting us, because that is going to be the one that will motivate us to move forward, to change, and to be a better individual. So not all the time, because the life of a frontliner can be very hectic. So it's important for them to be able to pause and listen to themselves. Okay, because it's very critical, because they during the day, or even during the night, of course, they're doing so much, but they need to be able to have that quiet time. And we're familiar with meditation, of course. So like meditation and mindfulness could be a good strategy as well for people to be able to just slow down, and chill, and then be able to have a better understanding about what we're doing. Next is to look for one or few trustworthy individuals who can listen, advise, guide, or help. Because this is part of the emotional support that we need. It's difficult to be, especially if you're in a very challenging situation, that when you feel that you're doing it all just by yourself, you feel isolated. It can be very critical to know that there is someone who is willing to help. Okay. And people go through this in terms of what we refer to as shared experiences. And this helps form a good bond, a sense of camaraderie that can be very helpful as well, particularly in the long run. But a lot of us have issues that that we want to be able to get off our chest, and therefore to have someone who can listen to us, talk to us, provide good advice or guidance could be really very helpful. There's a special group of tips that I'm talking about lastly, okay? And I felt that in one way or another that they deserve a special mention. Prayer. In the silence of our hearts, together with our loved ones, or in one global single voice, praying can be very helpful to a lot of us. Because praying in a way is like meditation. And to a lot of individuals, prayers can give that calm sense of reassurance. And so therefore, it can be very helpful. I know a lot of frontliners who start their day with a prayer and end their day with a prayer as well. And we've seen photos of frontliners before they start work that they have a group huddle and then they pray. And that's great because, uh, because at times, you don't know what's going to happen. There's a high degree of uncertainty, but praying can, assuage that, can help people and, give that sense of assurance. Let's be kind. So we need to practice compassion and empathy because there are times that we can become angry, we can become impatient, especially when things become so frustrating. But we need to be able to understand what's going on and be able to understand where other people are going. We need to remember that as frontliners particularly need to remember that this is a new situation, that a lot of us have not gone through this situation before. And so therefore, decisions that are being made by the government or by their bosses, often change on a day-to-day basis depending on a given situation. So therefore, we need to be able to understand that. So being compassionate and empathetic, not just to ourselves but to others as well. Okay. And to be kind, I need to emphasize that because a lot of frontliners feel very guilty about feeling that they have not done enough. Okay, and so that develops a great sense of frustration, and and therefore they need to understand that they need to be kind to themselves as well, especially when they have already done so much and they have already worked to the best of their abilities. This one I particularly like because we've always said that laughter is the best medicine. So let's find the funny because laughter can help break the cycle of the negativity that often pervades in a given situation, particularly when things become very hectic and we don't seem to know what to do. And this is something that can be very helpful to individuals. And then finally, we need to find meaning. We need to understand about what we're going through. We need to be able to make sense what all these things mean. And it may not be something that can be done right away. It may be something that we can do later on when things maybe have settled down. Okay, but it's important to understand what our actions meant, what we have gone through, what is its impact on us. Okay. And for the third segment, of course, for this section, the objective is to recommend how healthcare institutions can address mental health concerns of their employees. Again, Dr. Vergara has already outlined important steps. And of course, I don't want to reinvent the wheel. So allow me to share with you an infographic from the Philippine Council for Mental Health, because I feel that, with this short 7 steps that they've outlined, that it can already be very comprehensive. Okay. So this infographic lists steps to promote the psychosocial well-being of our frontliners. Let us go through them one by one. Okay. Number one is to, frontliners should be allowed to express their fears and apprehensions and their frustrations. As we have learned in psychosomatic medicine, sorrow that is not given vent in tears will make the body weep. A recent local study by Nicomedes and Avila has shown that a significant difference in terms of health illness anxiety behavior, or what we more commonly know as hypochondriasis, among those who were possibly exposed to COVID-19 compared to those who were not. And the work of medical frontline is fraught with difficulty and challenges which give rise to a complex set of emotions that can include anger and guilt. Thus, they should be provided opportunities to release those emotions. Number two, recognizing their hard work during this crisis is important. And this involves not just sufficiently compensating them for their efforts, no, because their safety and welfare should be assured as well, including adequate supply of personal protective equipment and having protocols and guidelines in place that will guide them in their work and relieve them of the emotional and psychological burden of some decision-making instances. Number three, according to the Center of Evidence-Based Medicine of the University of Oxford in England, physical and psychological self-care were the 2 most important factors in facing the pandemic. Okay. So frontliners need to be given time to take care of their themselves and their basic needs too. Okay. And these are more critical for frontlines because they face a huge challenge. And again, this is very basic, something that's very critical. And oftentimes we overlook this. We skip that meal. We skip. spending more time sleeping or resting because we feel that, we can make better use of our time. But, we need to change that kind of thinking and then try to focus more in terms of making sure that we are healthy to be able to better help other people. Okay. Now, frontliners may be subjected to stigma due to the nature of their work at this time, notwithstanding their possible exposure to the virus itself. So let's protect them from stigma and rejection. Fortunately, these have become part of the IATF guidelines in terms of protecting them. Okay. And more importantly, it is critical to address the ignorance that have given rise to the stigma that frontliners face. Because a lot of it is because, there's a lack of information that filters to the general public, and that's why they're reacting adversely towards frontliners. Number 5, finding time to reflect is important in maintaining positive mental health. The capacity for introspection or self-analysis can be of immense help to anyone, including frontliners. Thus, as I have suggested earlier, we need to have that quiet moment when we can look into ourselves and be in a better position to understand our emotional and behavioral responses. And in this situation, again, as I've mentioned earlier, both meditation and mindfulness can be helpful tools. Number 6, everyone needs or will benefit from someone lending them an ear. Okay. And we need to encourage our frontliners to be open to accept help from a friend whom they trust or seek a mental health professional, and not be afraid that they will be judged as a failure or a mental patient. And our medical frontliners are in a very stressful line of work. And that's why formal measures such as counseling and psychotherapy or informal measures such as psychological first aid will be helpful. Dr. Vergara mentioned about psychological first aid. And just to highlight that a bit, the first step in providing psychological first aid is reflective listening. Okay. And so therefore, when a frontliner vents his or her frustration, the other person, all they have to do just simply listen. And I mean, they don't have to say anything specific, They just listen. They just allow the frontliner the opportunity to be able to release all those emotions. The problem with stigma of mental health consultation is still prevalent, and thus what we provide would be discrete appointments. So for example, like at UERM, they can send text messages, and then a schedule or appointment will be provided. Finally, hospitals and other health-related institutions have a specific responsibility to take care of medical frontliners and ensure that policies and procedures are in place to ensure their well-being. Okay. Because this can be very helpful and can minimize the sense of confusion that some frontliners may experience when they work. Now, I'd like to share what some hospitals in Metro Manila have done to provide health for their medical frontliners. Of course, I'll start with UERM because I'm more familiar with what we have been doing there. Okay. So at UERM, within days of the start of the ECQ, the Department of Psychiatry, headed by Dr. Norieta Balderrama, opened both phone consultations and face-to-face individual and group sessions for UERM frontliners, and mostly availed of by doctors and nurses. Interestingly, UERM alumni working in other hospitals which did not have psychiatry departments requested if they could be helped as well. And of course, that request was accommodated. So the consultation services were opened up to even others who were not working at UERM. And what the department did, particularly from the creativity and inventiveness of our residents, of course, was that they sent messages and reminders via text and social media. Okay. And it was also helpful that at UERM, the chief of clinics, Dr. Erman Panjalan, was very concerned with the welfare of the residents and encouraged them to seek help when needed. And he frequently facilitated the referrals himself. So that was great. Okay. At the Medical City, their Department of Psychiatry, headed by Dr. Imelda Batar, had very progressive strategies, including regular kumustahan text messages. So very frequently, yung mga frontliners, tinetext nila every day, like in the morning, like, kumusta ka na? How is your day going? Okay. And they did, no, and I thought this was a very good use of technology. They did a series of online webinars accessible via social media. Like, for example, what you see now, they partnered with Mental Health PH and did a series of what they called MH Talks. No? So episode 4 was about supporting the frontline healthcare workers. No? And of course, aside from that, they also did individual and group counseling sessions. So I think this was really something that was very progressive and innovative. And then finally, at Makati Med, no, similar services such as individual and group counseling were being offered by the psychiatry section headed by Dr. Lovi Gochu. And what was great about the service that they offered was that they expanded this to non-medical personnel as well. You know? So not just like doctors and nurses, but they also opened up to security personnel, mga janitorial services. So everyone working in the hospital could avail of the services. So just to recap that section, I just wanted to emphasize that what you will see that the core services in this situation, if we're talking about taking care of the mental health of our frontliners, the core services will actually be very easy. Just to think of it as essentially two processes, providing individual counseling and the group psychosocial processing. Particularly, for example, in situations when you have limited psychiatry resources, or we don't have a lot of mental health care workers. So group psychosocial processing would often be the better alternative. Okay. And then let's also see what some hospitals, other things that hospitals have provided, particularly in practical and valuable ways. And I thought, these were really very interesting, and I thought very great initiatives. So there was a hospital that provided groceries on site, and then a lot of hospitals were providing free haircuts, and of course dorms for the frontliners to stay in, then shuttle service. Okay. And so this was great because at least this helped minimize the other issues, other pragmatic issues that frontliners had to deal with because they needed to focus their energies on helping the patients that they needed to take care of. Okay. So in conclusion, I'd like to close with a letter from Mr. Antonio Guterres, the Secretary General of the United Nations. And this was something that he uploaded on May 13th at the website of the United Nations. This was entitled "Mental Health Services are an Essential Part of All Government Responses to COVID-19." And he said, mental health is at the core of our humanity. It enables us to lead rich and fulfilling lives and to participate in our communities. But the COVID-19 is not only attacking our physical health, it also increasing psychological suffering. There's grief at the loss of loved ones, shock at the loss of jobs, isolation and restrictions of movement, difficult family dynamics, uncertainty and fear for the future. Mental health problems, including depression and anxiety, are some of the greatest causes of misery in our world. After decades of neglect and underinvestment in mental health services, the COVID-19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline healthcare workers, older people, adolescents and young people, those with pre-existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them. And with that, I'd like to thank you for your kind attention. Maraming salamat po. So I'll turn it over back to Dr. Demere.
Thank you very much, Dr. Benaventura. That was an amazing session with you. We already have a lot of questions. Indeed, we have picked up a lot of gems from both speakers. And I guess the biggest thing that we have to remember is to take care of ourselves when we feel there's something wrong with us and to be ready to listen. And what I really want to highlight is a very beautiful insight that we should pray all the time. We should show compassion and empathy. And the Philippine humor, right, Dr. Bong, is giving us resilience as health grief. This has to be processed so that we don't end up with mental health issues that would be deeper than just worrying. So our first question is, Okay, we just filtered in the questions and tried to see what would be, how we could best address, because there's a lot of participants. For the first question that either of the speakers can answer, how can we teach the public to be considerate and improve our information dissemination in terms of educating the public about the disease itself and the way they should handle the situation to prevent fear among the public, which can lead to discrimination of the COVID-19 positive patients and healthcare workers as well?
Mm. Jazz, I think that would be right up your alley.
Okay, thank you po. Thank you, Doc Bong. Thank you, Dr. Demery. Uh, um, thank you for that question. Indeed, that's an important element of this. And we acknowledge that fear is part why most likely people are, there are some behaviors that are arising from, arising in stigma, resulting in stigma behaviors rather because of fears. But as mentioned, some of these fears and reaction may spring from realistic dangers. Tama naman, it's all right. However, many reactions and behaviors are also born or generated by lack of knowledge, rumors, or misinformation. So having to have a channel of providing facts. When we advise the public, we advise facts of how they can access help, how to protect themselves and their family to keep them safe, and get back to what they're doing, and that's finished. And then avoiding sending or forwarding messaging that are not not verified, not to instigate more stigma and fear. That can address that situation. And also, aside from social media or traditional media, we'll have to reach out to people also in the far-flung areas, the barangays, the GIDA areas, via maybe printed materials or posters, ensure that they have the right information, the facts, where to access help, what to do when they become sick, and how to protect and promote their mental health and physical well-being. Thank you.
Thanks, Jess. I'd like to add to that and just emphasize what Jess mentioned about reaching out, particularly at the grassroots level, because I feel, but this is just a personal observation, that we have not been able to filter down to that level the information that people need to understand. For example, why do they need to wear face masks? Okay, what is the importance of hand washing? So I think there should be a mechanism by which the government can accomplish that. Where I live, and I live in San Juan, Metro Manila, and I feel that the government here, the local government, has been very active in that regard. But there's still limitations. But I feel this is something that can be expanded more. Thanks.
Thank you very much to both of you. Yeah, we have a lot to do to improve our mental health awareness and probably our facilities to address. There's a lot of stigma attached to mental health, and a lot of patients or people suffer alone. So I think COVID-19 is teaching us to come out, right? And to be aware that being mentally healthy is baking. And if healthcare workers are healthy, then we are better able to efficiently offer services to our people, right?
Right.
Our second question can again go both to Dr. Vergara or Dr. Bong. What are some action points or strategies for health workers to further prevent social stigma, given the situation that some local government units have not accepted recovered COVID positive patients for reintegration back into the community?
Mm-hmm. Sige, I'll start this off, Jazz. Okay, just to be fair. Okay. Yes. Again, like what Dr. Vergara mentioned, one of the better ways kasi to deal with stigma is really providing factual information. Sometimes that sounds a bit redundant, factual and information, because we should assume that any information should be based on facts. But unfortunately, as far as mental health is concerned, there's still a lot of misconceptions about it. For example, like the role of mental health and psychosocial support, which is we need to emphasize that the provision of mental health and psychosocial support in any pandemic, in any major health crisis, should be factored in already at the start. It is not something that we think of like 4 weeks or 2 months down the line. That's when we start to think of, we need to provide psychological support to our mental health, to our healthcare workers. No, at the start, it should already be part of the overall plan. So the governments tend to minimize the importance of mental health provision, and therefore, this sort of creates a pervasive understanding that mental health is not that important, and therefore this again in a way reinforces the stigma that we encounter. So if the government, okay, let's not just put it on the government's shoulders. So if we can put more importance as far as the role of mental health, and then provide factual information about psychological responses to illness like this, I believe that can help minimize the impact of stigma.
Thank you, Dr. Bong. Just to add
Thank
also.
you, Dr. Bong. Then we hear from.
Yes, thank you, Doc. Just to add also at the community level, at the local level, with the Mental Health Act, this is a very beautiful law for the Philippines to be being enacted in 2019. But the challenge is having to have this implemented in the ground, because already the information and the strengths and the policy are there, but to implement it down the leaders of the local government leaders, the leadership, the staff, the supervisors, the managers, I believe they should also be trained of, aside from giving the facts, the factual information to the people or the community, it's how to deliver it. Having that communication, or how that have that empathy when talking to, let's say, a contact tracer, having to call someone and relay that message about the processes and everything. Everyone should at least be trained on psychological first aid, having to have that principle of look, listen, and link. You don't have to be an expert in counseling, but having that communication skills, listening skills of empathy to relay that information. And if you're in the capacity or don't have the capacity to provide that intervention, you'd be able to link it to another service provider or a rightful office or institution. So that should be a clear message for everyone, and that coordination mechanism.
Yes, thank you, Jazz. Thank you, Dr. Vergara. Indeed, we all have a role, and we should have a broader mind in thinking about that everybody will be subject to psychological stress and toil, and so therefore we should all be ready to give psychological as well as mental health first aid. In other words, we don't condemn, and every day we pray that we are thankful for the day, and as the Bible tells us, to always ask for the renewing of our minds. It's always a renewing of our minds to be ready for the day and to be able to face the challenges. That's why this brings us to our third question, that what are the basic steps or pointers that healthcare workers can follow to facilitate stress debriefings for their colleagues? And in your lecture, you showed that anybody can be a debriefer, but the question is really, how can we better be able to debrief when it's needed at the workplace?
It's not that easy. Because like in our case, we need to go through training for that. I feel very challenged right now to be able to outline some of the steps, because ideally it would require at least a half-day workshop. So what do you think, Jess?
Thank you, Doc Bong. Yes, there are different forms of, I guess, maybe if they're talking about the psychosocial processing, I guess, right, because you have to have some, skills and, expertise to deliver that. But there are other means of psychological support that anyone can be trained also to provide. So I think it's highlighted here, Doc, as the capacity building also.
So in short, siguro I would just highlight like yung nabanggit mo nga Jazz about psychological first aid and reflective listening. I feel that, we just need to be able to tap into our sense of compassion and empathy for others, because that will propel us to approach them. And like what, for example, like what the TMC had done, they would send text messages to the frontline workers and just ask them, how are you doing? Are you okay? Kumusta ka na? Okay. So that's a good first step. And then just allow the individual to be able to express their frustrations. Unfortunately, one of the what to truth to tell, for example, yung Mind Matters consultation ng Philippine Psychiatric Association, most of our callers were actually not the frontliners themselves, no, mga relatives nila. There were some factors kasi that limit the frontliners from seeking help directly. Number one was of course time. So they, and Jas already mentioned this, no, they were doing a lot of work, and then they were often tired, no, so therefore a lot of energy was focused on just resting. But the thing is, they also didn't think that they needed help. Okay. And so that's what one of the things, for example, like at UERM, that we wanted to emphasize with them. So yung mga messages na pinadadala sa kanila is yung ganon, no? And then, and particularly kasi, we're talking about our resident physicians who are young individuals who have this sense of omnipotence, omniscience, no? So may feeling tayo, di ba, at that age na, kaya ko to, no? Na I can go through this. And so therefore, they have this assumption na they don't need it. Okay. And for my perspective, kasi that can be a dangerous thing, because studies have shown that, for example, like the experience in Canada and in Hong Kong, no, when they went through SARS epidemic, they found out that a lot of frontline health workers developed what we call delayed post-traumatic stress disorder. So the symptoms came out mga 1 year or 2 years down the line. Okay, unlike non-frontline healthcare workers, yung sa kanila nag-diminish yung symptoms over time. But for some frontline healthcare workers, lalong dumami yung symptoms. Nag-manifest na lang yun later on. So people can have that delayed stress response. But we can avoid that by dealing with the issues at the present time. And that's why at UERM, we really encourage them to seek consultation.
Thank you very much. Yeah, indeed, it's not easy to be in the front line and sometimes to see our fallen heroes beside us. But I guess that was really good that you said that maybe in our sleep we can just put that we're ready to listen, ready to learn, and ready to link. We should know these online resources that you have told us about, Dr. Bong, the telemental health, so that we can probably identify these people who we need to link up with more professional help. But as long as we are willing to listen to those who are kind of down psychologically, because really the psychological toil can hit us anytime, not just because of the COVID, but even our own stresses, our own trials, right? So again, we probably would need to train more, maybe inculcate it in residency training already. PCP is listening to us. Maybe that is really going to be a good way to teach our residents as well to how to handle psychological toil or give psychological first aid, don't you think?
Right.
Yeah.
Right.
So anyway, we have many more questions. If I can just go through each one. Can you give insights on how healthcare workers who do not have the expertise in addressing psychiatric concerns manage mental health? That's really what Dr. Bong already said. It's kind of difficult to give like a pathway or steps and all. that we can manage mental health problems during this pandemic. They probably just really want to know how we can give psychological first aid aside from listening, learning, and linking.
Mm. Yes. Okay. Kasi right now we're working on the premise, like kasi like Dr. Vergara at the start of her lecture said about the common responses. So these are considered normal. So ang sort of ang dictum namin ngayon, it's okay not to be okay, which gives rise to the question as to when is it not okay to be not okay. So Dr. Vergara showed a very nice graph, no, yung transition from normal common responses in stages, ano, then to the point that when should you be able to refer. So you could use that as a guide, no? And I mean, Dr. Vergara will have has shared her presentation naman, and PCP can give that to you, and you can look at that graph because I think that's, to me even, that I feel that's very helpful because this will give you a better idea about what behavioral or emotional manifestations could be signals as to when is it still within the purview of normal limits, or when is it something that needs to be referred to someone who has more expertise in providing psychological care. But at the very least, no, listening really, and then providing specific practical support. Oftentimes kasi, and I'm glad that Dr. Demere mentioned this, we need to remember that frontline healthcare workers are not just dealing with yung what's presented to them in the hospital, because we're all human beings. That means paglabas nila ng ospital, meron din silang ibang concerns, no? They may have another family member who's also ill, or they have bills to think of, no? So all these other concerns can magpagpatong-patong yan sa isipan nila. Hindi lang naman yung COVID-19 ang hinaharap nila. There are other concerns as well. And so therefore, the more issues that an individual has to deal with, the more manifestations that they have, no, based on that graph that Dr. Vergara shared, will give us a better idea who among our frontline healthcare workers would need more specific support. But it's important for them to be able to access as well those free counseling centers, because they can provide screening as well. For example, yung NCMH crisis hotline, when the online counselor feels that the caller needs more specific support, they schedule the caller to have a one-on-one consultation with the psychiatry resident. Okay, so pwede rin yun, ano. So someone who's distressed can go through those crisis hotlines, and they can be given a better idea as to the extent and severity of what they're going through. And of course, for example, like look in terms of the services provided by your institutions as well, in hospitals ninyo. If they have a psychiatry department or psychology or HR department, no, because they're also involved in this, no. See what resources can be available that the frontline healthcare worker can make use of.
May I add, Doc Bong?
Sure.
Just to add on that, I know there are different levels of intervention and there are different levels of need. And maybe that the institutions and the healthcare workers can be provided, specific, tools and skills that they can actually use to help themselves and others. But that's an important question that at least it was raised, and having to extend that help. I'd just like to also highlight this, that looking after yourself and team members for the healthcare, frontline workers working in the COVID-19, we should look at this and your mental health as not a luxury. It's not a luxury, but it is a responsibility. How we take care of our physical health, talagang kasama doon ang mental health. So by imbibing that stance, we're able to, open up more opportunities in our policies in the workplace of highlighting mental health in our everyday routines. Thank you.
Thank you for that, Jack. And just to follow up on that, since you work with the World Health Organization, the question is about you working closely with the Department of Health. Can you provide insight into what the government is currently doing and future action points to support the emotional and psychological effects of COVID positive patients and probably also healthcare workers?
Thank you for that. And we are happy to support, and we have been working with the Department of Health even at the onset of this COVID-19. From drafting guidelines, they have released the department memorandum for MHPSS in the context of COVID-19, encompassing all our international guidelines and advice, as well as adaptation or implementation of some key strategies and plans. I did mention that the Philippines is one of the 6 countries that have started work with the special initiative for mental health, that universal health coverage for mental health. So we are revisiting the strategic plan, designing a 5-year program design under the special initiative, encompassing also the strategic framework for the COVID-19 response on mental health and psychosocial support. Any short-term prioritization and long-term activities will be covered in that. We have already supported the Philippine, actually by this week, the Philippine Council for Mental Health will be convening, so we will be updating them. DOH has convened series of sub-cluster meeting of the mental health and psychosocial support, covering the different, aligning the plans and actions with their CHD's focal points on mental health, substance abuse, and MHPSS, how to address the recommendations of the IASE in identifying, putting up some activities and plans in their regions and in their municipalities and cities have been there. That's the follow-up. And on the front of frontline workers, the Department of Health is actually leading a behavioral design intervention for maintaining the mental health and well-being for frontline workers. Because there have been some studies that have been conducted for medical or frontline workers that they have identified the need for mental health, visuals, or they identify the need for more mental health supports. And we're helping the Department of Health design that intervention of, providing some, like nudges or local context strategies that can help remind or promote mental health and well-being for the frontline workers. So I believe that will be, DOH will be sharing that news in later days or weeks to come. Also, a lot of works on the suicide prevention strategies that already are part of the Philippine Mental Health Act objectives. So to scale up services for the community settings, general healthcare settings, and the specialized settings. That will be in place. So look out for that. There's also ongoing a platform to elevate human rights in recovery, what we call the Quality Rights Initiative. It's an online platform that highlights mental health and quality rights. It's translated in Filipino, and we can also share that training platform. Everyone can log on it and go through an 8-hour straight training or face it yourself, and imbibe of how a quality mental health care centering on human rights and recovery can be provided. So a lot is happening for the Philippines on mental health, but we need everyone's support. Everyone has a role in this, and it's everybody's business. Thank you.
Mm-hmm. Dr. Demere, may I add? Kasi at the local government level, may alam kasi akong 2 instances lang with Pasig City and San Juan City. So with Pasig City, si Mayor Vico has coordinated with the psychiatrists at Rizal Medical Center, not just providing psychosocial support for frontline healthcare workers, but for government staff as well. So that's great. And then in San Juan City, the wife of the mayor the wife of Mayor Zamora has coordinated with the Philippine Psychiatric Association in including them for the Mind Matters, yung phone consultation. So maganda yung binanggit ni Jazz from a top level, but also we need to understand that local government units have their own initiatives as well. So which is great, of course.
Just to add, Doc, today or last week, the Department of Health also launched the Substance Abuse Helpline, which has been there before. But since COVID-19 situation, and we know that stress is also can lead to people, falling, falling to some unhealthy behaviors such as drinking alcohol or, using drugs. And so they launched the 155-0 hotline for substance abuse, and later on, actually, we're having another webinar. We're also through that with the Department of Health on MHPSS for the responders, especially for the vulnerable population, people with mental health conditions and substance abuse disorders.
Thanks, Jazz.
Thank you very much to both of you. There's a lot of work being done and has to be done. And because the Philippine College of Physicians would want to take on as well the burden of dealing with mental health in the country, we would want to ask if it's palatable to you that we will have partnerships with the Philippine Psychiatric Association and the Department of Health to help bring out your initiatives down to the grassroots. Like there are a lot of NGOs going to mental health. There's also LGUs going to mental health. But sometimes in the end, the people in the, the consumer, if you can call it consumer, the end user or the grassroots, they're not really reached. So in our own way, as the Philippine College of Physicians, with the leadership of Dr. Mario Panaligan, we would want to present ourselves as your partners, if you can use us to be able to train more people, to be able to reach out to more people, so we can help, NGOs, LGUs, government, private sectors, because even doctors, we need to be aware of our mental health and our capacity to deliver good, mental health awareness and whatever resources we can share.
I think that's a brilliant idea because, for example, the PPA has 2 years ago started to work with the PNA on a pilot project in Baler. So, and I think your idea is great. I mean, we're always welcome with such collaborations, and particularly from our perspective, because PCP, of course, I would understand would have a better infrastructure as far as reach is concerned, and therefore, I think we would be very honored to be working with PCP in that regard.
Thank you very much.
Thank you, Doc Bong. Yes, for us also.
We have more questions. Yeah.
As we work with DOH, would be looking forward for your partnership.
Yeah, thank you, Jazz. We will look forward to partnering with you. We have more questions, if you don't mind. Either of you. Can you give insights? We already said that. Can you give insights on how healthcare workers who do not have the expertise in addressing psychiatric concerns, is it a possibility that they can manage mental health problems during the pandemic through a remote guidance from a psychiatrist? Is that possible? Would counseling by psychologists under remote guidance be possible?
Yes, but psychologists themselves, can actually do the counseling with even without the guidance of a psychiatrist, because usually for example yung relationship ng Mind Matters with UP Diliman Psychological Services. For example, yung mga screen ng UP Diliman Psychological Service, if they feel that this borders on something like a clinical syndrome, then actually they refer to PPA. Okay, so which is great. So there's a very good interaction in that regard. But a lot of times kasi counseling lang yung the range of psychological response that we're seeing right now can be sufficiently be addressed through good counseling, and psychologists can do that on their own even without the input of a psychiatrist. But if they feel that, this is a clinical syndrome that needs other forms of treatment, then they generally refer to that. Because, for example, like I'm doing a survey right now on the impact of COVID-19 on elderly Filipinos, and so far, based on the preliminary results that we've seen, about 11 to 12% of them do have significant anxiety and depression, and therefore may require further intervention. But what I'm emphasizing there is that a greater majority are actually able to handle it. No? May mga manifestations sila, may mga psychological responses such as fear and anxiety, but manageable. Okay, and this can be dealt with by simple counseling or being able to express their fears. But there is a segment that would require further treatment.
Thank you very much. It just shows that this is really a very interesting topic. We're kind of past 12 noon, but I have one more question for you from Dr. Alvin Loyola, is the chairman of our continuing Committee on Continual Medical Education. He asks if you will recommend healthcare institutions to carry out regular screening mechanisms to identify depression, anxiety, and other psychosocial concerns among frontline workers. What mechanism should be in place and how often should this be done?
Oh, screening. Jasmine, may policies ba kayo about screening?
Doc, well, for different levels, as mentioned, there are different levels and there are different example. If that organization, let's say they have a policy for, they have a focal person, let's say a physician there that are their focal person for mental health or psychosocial needs at the primary level. And that person is trained on MHGAP. That's a form of screening at the level of a non-specialist that can be referred or can refer to specialist care if there's a need to. So, well, the idea is actually to highlight, we're not just going to look at these disorders, but we actually more of mental health promotion and prevention of mental disorders before it actually comes there. So there are actually some self-report questionnaires that are available even for substance abuse. In the paradigm of the substance abuse work, there's this client flow for wellness that they use to assist alcohol screening tool and the RQ for mental health, and there are different scores that they can go to different levels of care as well. So there are different that we can explore, and that's part of the overall different levels of care.
Right. So that's why I agree. That this is a good idea in screening, because actually we've thought about it initially for medical students, but thinking about it in terms of healthcare workers, not just frontliners, would be a great idea as well. Because it's not just now that we're dealing with, not just because we're dealing with a pandemic that we need to think about this, but we need to remember overall that the work that medical individuals do, whether doctors or nurses, can be stressful just by itself, with or without the pandemic. I mean, the pandemic has just made it more critical. But the idea of screening, I'm all for that. And again, it would depend on what the institution's needs are and what the screening would be for. Because ideally, at least on an annual basis, parang APE, parang annual physical exam, then that's what you would do. You would screen on an annual basis. But for those who have an identified risk, then you can do follow-up screenings at more frequent intervals.
Thank you very much. We indeed had a very good discussion, and if you had only more time, we could deal with all the other questions. But we thank the two experts, Dr. Vergara and Dr. Benaventura. And I think the take-home points will be we should look out for our physical, mental, and spiritual health. We should be ready to listen, to learn, and to link. We'll not forget to pray, show compassion and empathy on a daily basis, laugh, and eventually you'll find meaning in your life. Don't be afraid to say, I'm not okay. Be ready to say that, process your grief, and just talk it out. And if there's any mental health issue already involved, we have online resources, we have experts are ready to address concerns. And definitely PCP will be honored to link up with the Philippine Psychiatric Association and the Department of Health. And with the guidance of Dr. Vergara, we will have a global view or perspective about this. Now, we have to close because it's past 12. Can we ask probably Dr. Biruar or Dr. Panaligan to close this session?
I'm not sure if Dr. Panaligan is online anymore, but I'd like to thank everyone, all our viewers, our speakers, and also Dr. Demere for moderating this activity. We really think that there's a lot of help needed regarding mental health, and since this under the expertise of PPA, Dr. Demere has emphasized that we really need a partnership also to help our health workers, especially our internists. And so I'd like to end this by inviting everyone to our next webinar, which is scheduled next week, which is on renal involvement in COVID-19. This is going to be delivered by Dr. Roberto Tanchanco of the Medical City and Ateneo School of Medicine and Public Health. So have a good day, everyone.
Thank you.
Thank you. Take note of the date. It's not supposed to be June 29. It's next Monday, the next webinar, renal involvement.
Oh, yes. I'm sorry, Doctor. Yeah, it's supposed to be July 6th. It's supposed to be every Monday. We have this recurring webinar with the PCP in partnership with DOH. So next Monday on July 6th.
Yeah. Thank you, Dr. Ding Dong Biruar, our Board of Regent. Thank you, Dr. Vergara. Thank you, Dr. Buenaventura. Thank you so much for generously sharing your expertise. And we will be contacting you. We will work closely with you. And we truly thank you that now you know that the Philippine College of Physicians has a burden as well to help carry mental health awareness to erase stigma in this country. Thank you very, very much.
Maraming salamat po.
Salamat din po.
Yeah, salamat. So officially ended. Thank you, participants. Thank you, everybody.